I think America and the world calls for the need for innovation in making sure that we have new drugs, new biomedical products, new medical devices to speed to the clinical practice of our people. And just in the same way we need innovation in the production of new drugs and bioproducts and devices, we also need innovation in the legislative process. This is what the Spending Reduction Through Innovations in Therapy Act is all about. A new way of moving legislation forward in a public-private partnership where it's not government owns and operates research and the private sector owns and operates the production of products. We need partnership, and we need it now because there is a rising and escalating number of people with chronic diseases, from diabetes, cardiovascular disease, Alzheimer's, and in some instances, they're even linked. That if you have diabetes, good chance you're going to have heart disease and cardiovascular. If you have that, it could be a double whammy that yet to be reasons we need to know on those things related to Alzheimer's. So we need new ways, and this is a new day. This problem has been felt by many of us up here. George spoke eloquently about his own family situation. My own dear father, who, a working class guy, but believed in his daughters, saw to our educations, provided for us, protected us. When it came time to provide for him and protect him from the ravages of Alzheimer's, there was very little to do but to keep him comfortable and see him through his long journey goodbye. We know that Alzheimer's is an equal opportunity disease. We stand here together, but we could have Nancy Reagan here. Our own wonderful Justice Sandra Day O'Connor is now with her long goodbye with her own beloved husband. So we wanted to move ahead. We've been working on this for some time. My colleagues up here joined in a bipartisan and bicameral basis and with intrepid advocates in George and Trish Vanderberg and the issue of Alzheimer's. So what was the new way and the new day? The new way and the new day is to have a legislative framework that, first of all, has focus. And what are we focusing on? Those chronic illnesses that are enormously costly to families, out of their wallet and heartbreak, and that which is enormously costly to those federal programs that pay for health care. By focusing and targeted, we're focused on that. And then the next area of focus is on those areas of drug or bioproducts that hold the most promise, because we don't want them lingering or stuck in the valley of death from research through a clogged pipeline, like clogged arteries, can't get out to clinical practice. This is a new way where government, through its basic research, lays the groundwork. The private sector, through its venture capital and on, gets themselves going. But they're spotted based on those work that is going to affect the most people and the most costly of the diseases affecting America, and then through a public-private partnership, be able to move them forward with the funding that they need to be able to get these products into clinical practice. So it focuses where the focus needs to be, on chronic illness, that is the biggest cost. It focuses on where work has already been done. So it's on those that are promising but are stuck in the pipeline. And then it focuses FDA on being focused on that. So this means that we're going to sprint ahead. I would hope that we would beat that 2025 benchmark, and I'm sure we will. And I am so excited about being an original co-sponsor of this bill and being able to move it forward. My father was a modest man. He was actually shy. My mother was the talker, and I'm a genetic clone of my mother. My father would never have wanted a memorial. though my sisters would always want to throw a big party for big benchmark birthdays or whatever. My memorial to my father is that no other father would have to endure what he did. For all of the wonderful people that have made sacrifices, that are now sitting there with these issues, we want to stand with them. And we have this great bipartisan effort to do so.